All right, let's jump right in. We're talking about infant and young child feeding, or IYCF. Now, this is a really cool topic because it's where pediatrics and community medicine truly come together, giving you the skills to help build the foundation for a healthy life.
And let's be clear about the stakes right from the start. This quote says it all, doesn't it? Malnutrition is a life or death issue. So, what we're discussing today isn't just a chapter in a textbook, it's one of the most critical child survival interventions you will ever be a part of. So, here's how we're going to break it down. We'll start with the why, the foundation, then we'll get into the what, the actual science and guidelines you need to know. After that, it's all about the how you counsel patients, how the system works, and finally, where you fit into this whole big picture.
Okay, first things first, the foundation. Why is there so much focus on these early years? Well, it all boils down to this concept of a critical window. That critical window we're talking about, it's the first 1,000 days of life, from the moment of conception all the way to a child's second birthday. The nutrition a child gets during this time literally shapes their brain, builds their immune system, and basically sets the stage for their health for the rest of their life. The impact is absolutely massive and permanent. So how do we protect that critical window? It comes down to a few core guidelines that you'll need to know inside and out, not just for your exams, but for your day-to-day practice. You can think of these as the absolute pillars of IYCF. Pillar number 1 is all about timing. We call it early initiation. This means getting the baby to the breast within the very first hour of life. This isn't just for bonding. It ensures the baby gets that first milk, the colostrum. It's packed with antibodies. It's basically the baby's very first immunization. Next up, for the first 6 months, is exclusive breastfeeding. And when we say exclusive, we really mean it. Only breast milk. No water, no honey, no formula, nothing else. You'd be surprised how often this needs clarification, but breast milk has all the nutrition and all the water a baby needs for those first 6 months. Then, right around the 6-month mark, the game changes a bit. Breast milk is still super important, but on its own, it's just not enough to keep up with a growing baby's energy needs. This is when we start introducing what we call complementary foods. And this timeline here just lays it all out so clearly. It's a simple but really powerful visual, right? You've got exclusive breastfeeding for those first 6 months, then you bring in complementary foods, all while continuing to breastfeed for 2 years or even beyond. Now, knowing all these guidelines is one thing, but it's only half the battle. Your ability to actually talk to a mother, to communicate this stuff with empathy and skill, that's what turns what you know into a real positive change for that baby. And this is where the rubber meets the road. You're going to be the one helping a new mom figure out positioning and latch. You'll be the one reassuring her that her milk supply is probably just fine, because that's a huge fear. You'll explain feeding on demand, and so importantly, you'll be that trusted voice that can gently and empathetically bust some of the myths she's been hearing for years. This here gives us a kind of national report card. And a 7 out of 10? That shows we've made some real progress, especially with counseling during pregnancy. But look closer at where the gaps are: postnatal care and community outreach. That period right after birth, those first few days and weeks, that's exactly where your skills are needed the most. Okay, so let's zoom out for a minute. The counseling you do as an individual doctor doesn't just happen in a vacuum. It's actually part of a huge national effort to support IYCF. First, look at this incredible opportunity we have. Thanks to a massive national push, nearly 80% of babies in India are now born in a health facility. That is a huge win, and it gives us this amazing chance to offer support right from the very beginning. But, and this is a big but, here's the reality check. Even though most babies are born in a facility, less than half of them actually start breastfeeding within that critical first hour. Just look at those two numbers together. There's a huge disconnect between where babies are born and the care they get right after. And that gap, that is your opportunity. That's where you come in. What you and the nurses and the other staff do in that delivery room can literally bridge this divide. You have the chance to be a real game changer. Now, to help close this gap, the government has some major programs in place that you should know about. You've got Mother's Absolute Affection, which is all about promoting breastfeeding. You have the Anganwadi services for counseling, and Poshan Abhiyan, which is a huge push to fight malnutrition. These are the systems that are there to back you up. And who makes all these programs actually work on the ground? Well, it's this incredible network of frontline workers. The ASHA workers, the ANMs, and the Anganwadi workers. They are the absolute backbone of this entire system, taking this care right into the heart of the community. So let's bring it all home. What does all of this mean for you? As a future doctor, how do you actually fit into this system and make a real impact? Well, it boils down to these 4 key actions. First, you've got to know the science. Second, you have to show a mother how to do it. Don't just tell her. Third, you must counsel with real empathy and build trust. And finally, your job is to link that family to all the support systems out there. I really want you to remember this. When you're in the clinic or on the ward, you are that crucial bridge. You're the one who translates all that science into compassionate care. And you're the one who connects a single family to the power of an entire national health program. So I'll leave you with this question to think about as you go through your training. It's not just about what you know from the books. It's about what you choose to do with that knowledge. How will you be the person who bridges that gap for every single child?